Good morning, everybody. Dr. Pradeep Srinivasan from Bangalore under the REFER series. REFER stands for Radiology Education for Enhancement of Radiologists. This is a very simple and short video for beginners and students on how to detect nuchal cord or cord around the neck in a fetus. What prompted me to do this video was one of the obstetricians called me and said that there was a scan done where the report said two loops of tight nuchal cord. There were other indications for intervention and a C-section was done not for the nuchal cord but for other indications. And the time between the scan and the C-section was very little. The findings were there was no cord around the neck. I asked for the pictures and then I saw the pictures. There were neither axial views nor sagittal views. There was just one picture of a cord folded on itself by the side of the neck. This is when I realized that there are some people who may benefit from this video. So to diagnose a nuchal cord, I will show you two cine loops now. So first we need to get a mid-sagittal view of the fetus and then move the probe on either sides of the parasagittal plane. The fetus has to have its spine in a dorso-anterior position. Use color doppler with a white box. You can see that the two loops of nuchal cord drape around the neck from one side of the neck to the other side of the neck, continuing on the posterior aspect of the neck. In the mid-sagittal plane, the cord is in its cross section and seen as two round bubbles in color, and in the parasagittal planes, the two loops of cord are seen on their long axis going from the anterolateral aspect posteriorly and then on the other side from the posterior aspect to the anterolateral aspect. We have to rotate the probe 90 degrees, get the cervical spine in its cross section. Here you can see the two loops of nuchal cord going from one side of the neck to the other side of the neck across the back of the neck. You can see that there is no liquor between the loop of cord in color and the soft tissues of the neck. So the only part which we have not shown is the anterior part of the neck, which completes the 360 degrees of the loop of the cord. This is usually possible in a smaller fetus or if the spine is to 3 o'clock or 9 o'clock position. But having shown it in sagittal and in axial for about 260 or 270 degrees of circumference of the neck with two loops closely opposed to the neck of the fetus, this can be considered unequivocally as two loops of tight nuchal cord. Thank you very much for a patient learning. Dr. Pradeep Srinivasan from Bangalore. Jai Hind.